In this video tutorial, I am going to discuss the isoenzymes of alkaline phosphatase, often abbreviated as ALP. Let's first look at what type of chemical reaction this enzyme catalyzes. If you examine the name closely, phosphatase means it removes phosphate from a compound. The word alkaline is included because this enzyme works optimally under alkaline conditions. So both things put together, alkaline phosphatase removes phosphate from a variety of substrate under alkaline condition. Now let us talk about the location of this enzyme. At the tissue level, alkaline phosphatase is present virtually in all the tissues, making it a widely distributed enzyme. However, certain tissue contains particularly high level of alkaline phosphatase. These tissues are the liver, bone, kidney, intestine, and placenta. In these tissues, the exact metabolic function of ALP is not clearly established. However, within the cell, it is present in hepatocytes as well as biliary canalicular cells. Here it is thought to be involved in a bile production and its secretion. Within bone, it is present in osteoblasts. Here it is thought to be involved in a new bone formation by adding phosphate to newly developing bone. In the kidneys, it is found in a proximal convoluted tubular cells. Here it is thought to be involved in a reabsorption of various compounds. Whereas in the intestine, it is present in mucosal cells. Here it is thought to be involved in digestion and absorption of fats, as well as it also protects the intestine from bacterial toxin by dephosphorylating it. In the placenta, alkaline phosphatase is believed to be involved in nutrient transport to the fetus. Now, if we discuss the location of alkaline phosphatase at the cellular level, we can say that alkaline phosphatase is an ectoenzyme. What does ectoenzyme mean? It means the enzyme is present outside the cell but not freely floating in the extracellular fluid. Rather, imagine a cell. Alkaline phosphatase is not inside the cell, but on the outer side surface of the cell membrane. So, on the outside of the cell, it is not in a free form. Rather, it is bound to the cell membrane by a phospholipid molecule called glycosyl phosphatidyl inositol, which is often abbreviated as GPI. So we can say that alkaline phosphatase is anchored to the cell membrane by this GPI anchor. Since it is present outside the cell and outside means ecto, it is called an ectoenzyme. Now, ALP being an ectoenzyme in all the places, additionally in the intestine and placenta, alkaline phosphatase is also a secreted enzyme. This means that intestinal and placental cells secrete alkaline phosphatase in free form into the serum. Now let's talk a little bit about the structure of alkaline phosphatase. The structure of alkaline phosphatase consists of two subunits, or you can say two polypeptide chains. And both of these polypeptide chains are identical. They are exactly same. Therefore, we call it homodimeric form because both subunits are identical. One very important thing to note here is that in many popular textbooks, alkaline phosphatase is incorrectly described as a monomeric form, which is absolutely wrong. Now, one interesting thing is that in different tissue, these subunits are different. For example, if you compare the liver form of ALP with the intestinal form of ALP, the subunits of liver ALP are different from the subunits in intestinal ALP. The same applies to all the major tissue I mentioned previously. Now let's talk about the isoenzyme forms of alkaline phosphatase. The naming of isoenzyme forms of alkaline phosphatase can create a lot of confusion. The reason is that in different textbook or resources, there are two completely different sets of names. In one system, you might see names like alpha 1, alpha 2 heat labile, alpha 2 heat stable, pre-beta, and gamma ALP. Whereas in other system, you might see names like liver ALP, bone ALP, placental ALP, intestinal ALP, and so on. So the question arises, which naming pattern is correct? Well, the truth is there are two systems and both are correct. One is an older, now completely obsolete naming pattern, and the second is a newer and more meaningful one. The old system is still written in many popular textbooks, which is why you need to know about it. But remember, the new system is what you should actually use in clinical practice. So what I am going to do is first quickly go through the older system so you can recognize it, and then we will dive deep into the modern logical system that makes everything understandable. Let's start our discussion with the older obsolete naming pattern of isoenzymes of alkaline phosphatase. This older system was purely based on how these isoenzymes migrated during starch gel electrophoresis, their relative position during the electrophoresis, and their stability to heat. According to this system, there are total of 5 different isoenzymes of ALP. These are alpha 1, heat labile alpha 2, heat stable alpha 2, pre-beta, and gamma. Alpha 1 ALP migrates in the alpha 1 region during electrophoresis and is primarily derived from biliary canalicular cells. Alpha 2 heat labile ALP migrates in the alpha 2 region. It can be easily destroyed at 65 degrees Celsius for 30 minutes. So it is called heat labile and it is derived from hepatocytes. Alpha 2 heat stable ALP migrates to the same position as the heat labile variety. So both heat labile and heat stable migrate to the alpha 2 region during electrophoresis. This is called as a heat stable because it is not destroyed at 65 degrees Celsius for 30 minutes, and this variety is derived from the placenta. Pre-beta migrates just ahead of the beta band during electrophoresis and is primarily derived from the bone, whereas gamma ALP migrates in the gamma region and comes from the intestine. Now, this naming system relies on memorizing arbitrary position and heat sensitivity without even telling you anything about the origin or function of the enzyme. This is why it has been phased out in modern practice. So, now that you have seen this old, confusing naming pattern of isoenzymes of ALP, let's throw this away and switch to a modern naming system, the newer naming system, which is based directly on the tissue of origin. Since it is based directly on the tissue of origin, it is quite intuitive, meaningful, and much easier to remember. So next I will discuss the newer or modern system of isoenzymes of ALP. To really understand this new system, we need to start at a genetic level because the modern classification is rooted in molecular biology. It turns out that humans have 4 different genes for ALP. These are ALPL, ALPP, ALPI, and ALPPL2. The ALPL gene is located on chromosome 1, whereas the other 3 genes, these are ALPP, ALPI, and ALPPL2, are located in different position on chromosome number 2. Let's first look at ALPL gene. ALPL gene is expressed in all the tissues. Its product is called tissue non-specific alkaline phosphatase or TNALP. Why this tissue non-specific in name? Because it's expressed in almost all tissue. So identifying this form won't tell you which specific tissue it comes from. But there is a twist in the story. The same TNALP formed everywhere, but it undergoes different post-translational modification in different tissue. Specifically, different number and position of sialic acid residues attaches to the enzyme depending on which tissue it's in. This differential glycosylation creates a tissue-specific variant. So, through this modification, we get multiple distinct forms: liver ALP, bone ALP, kidney ALP, and others. These forms are all products of the same ALPL gene, but they differ because of the post-translational modification. Remember from my previous video, when isoenzymes are product of same gene, we call them isoforms. The remaining 3 genes are much simpler. They are expressed only in specific tissues. The ALP-P gene is expressed only in the placenta, giving rise to placental ALP. The ALP-I gene is expressed in the intestinal mucosa, producing intestinal ALP. And the ALP-PL2 gene is expressed only in the germ cell, producing germ cell ALP. Now, since these four enzymes come from four different genes, and by definition, these isoenzymes are called as a true isoenzymes because they are coming from the different genes. Now, one more thing. Placental alkaline phosphatase shows variation across the population due to different gene allele. That means in one person, there is only one type. But across the entire population, there are many variants. This makes it an example of ALO enzymes. So remember, alkaline phosphatase isoenzymes are example of true isoenzyme, isoforms, and ALO enzymes, all in one enzyme system. And that's really interesting. Now, this germ cell alkaline phosphatase is remarkably similar to placental alkaline phosphatase. In fact, 98% amino acids are similar. And that's why the gene is named ALPPL2. Here, PL2 stands for placental like 2. Now, if you want to compare this newer system with the older one, liver alkaline phosphatase corresponds to alpha 1 and alpha 2 heat labile. Bone alkaline phosphatase corresponds to pre-beta. Placental alkaline phosphatase corresponds to alpha 2 heat stable, and intestinal alkaline phosphatase corresponds to gamma. Alkaline phosphatase is a plasma non-functional enzyme, meaning it has no function in the serum or plasma. However, due to normal cellular turnover, some residual activity is always present in the serum. In normal healthy adult male, total alkaline phosphatase activity is 43 to 115 units per liter in serum. This total activity comes from different sources. Approximately 50% from liver ALP, 40 to 45% from bone ALP, 3% from intestinal ALP, and the remaining 2% from all other sources. Now, there are three important situations where you will find physiologically increased ALP levels, and these are completely normal, not indicative of disease. So, first in children, because children are growing and have a higher osteoblastic activity due to newborn formation, they naturally have higher alkaline phosphatase level compared to adults. Second condition is after meal. Intestinal ALP normally contributes only 3% of total activity. However, after meal, especially a fatty meal, intestinal cells secretes more ALP into the serum. This is why it is always advisable to measure total ALP under fasting conditions. If the patient has eaten, you may get falsely elevated results. And the third is during pregnancy. The remaining 2% comes from all other tissues, including the placenta. During pregnancy, as placenta grows, its contribution to serum ALP increases significantly, leading to physiologically higher levels. So remember these three conditions: children, post meal state, and pregnancy. All can show physiologically elevated total ALP activity without any disease present. Now let's talk about the clinical significance of measuring serum alkaline phosphatase level. As we have seen, the major portion of serum ALP comes from two tissues, liver and bone. So obviously in liver disease and bone disease, serum ALP activity increases. Liver disease that elevate ALP includes cholestasis, which can be intrahepatic or extrahepatic, then liver cancer and liver parenchymal diseases like infective hepatitis and cirrhosis. In all these liver disease, serum total ALP activity increases. However, in cholestasis and liver cancer, the increase is very profound. Typically, in cholestasis and liver cancer, serum total ALP activity is more than 3 times the upper reference limit. Whereas in liver parenchymal disease, it's typically less than 3 times the upper reference limit. Now, various bone diseases also elevate ALP. Paget's disease, vitamin D deficiency, which causes rickets in children or osteomalacia in adults, then hyperparathyroidism, bone fracture, and bone cancer. In Paget's disease and vitamin D deficiency, ALP level can be more than 3 times the upper reference limit. Whereas in hyperparathyroidism, fracture, and bone cancer, it is typically less than 3 times the upper reference limit. So, by examining whether serum ALP is more than or less than 3 times the upper limit, you can narrow down your differential diagnosis significantly. Now, there is one interesting aspect about measuring serum ALP in cancer patient. In various cancers, different genes may start expressing at abnormal or ectopic location. Normally, placental alkaline phosphatase is produced only by the placenta because the ALP-P gene is expressed there. However, in some cancers, typically lung cancer, ovarian cancer, breast cancer, or testicular cancer, the ALP-P gene starts expressing ectopically. When placental alkaline phosphatase is secreted from this ectopic location, we call it the Regan Isoenzyme. Similarly, the ALP-PL2 gene is normally expressed only in the germ cells. But in some cancers, like ovarian cancer or gastrointestinal cancer, this gene starts expressing inappropriately. When germ cell alkaline phosphatase is secreted from this cancerous tissue, it is called as a Nagao Isoenzyme. There is one very interesting variety where both the ALP-P gene and ALP-I gene are inappropriately expressed in the same cancer tissue. This leads to the formation of heterodimer, means one subunit from the ALP-P gene and one subunit from the ALP-I gene. This heterodimeric form is called as a Kasahara Isoenzyme. So remember, these tumor-associated isoenzymes of ALP, these are Regan, Nagao, and Kasahara, can be seen in various cancers. Initially, this may create a diagnostic confusion. There is no bone disease, no liver disease, the patient is not pregnant, and patient is in a fasting state, yet serum ALP activity is elevated. So in such case, you need to perform electrophoresis to identify the specific isoenzyme in a serum. If these tumor-associated isoenzymes are present, it explains two things. First, why serum alkaline phosphatase activity is elevated, and second, that there might be an underlying malignancy. So, that completes our discussion about the isoenzymes of alkaline phosphatase. I know this video became a little longer, but it was necessary because during my own studies, I also got confused between these various isoenzyme forms of alkaline phosphatase. To explain everything clearly, I felt that extra time was required. If you have completely followed this video, then I am almost certain that no one can challenge your ability to interpret and report of alkaline phosphatase. So that's all. If you have any question or confusion, please write them in the comment section below. Thank you.